Welcome to the Global Health Matters. This is the live event series. Our focus today, as you can see from our beautiful backgrounds today, it's very important that we have the Ukrainian flag behind us. Our focus is on the emergency in Ukraine, the ongoing humanitarian and health crisis there. My name is Nadine Ferris-France. I'm the Executive Director of the Irish Global Health Network. So just to start a little bit, just to put us in context of where we are right now, according to UNHCR, today, 3.6 million people have fled Ukraine, and we've got nearly 6.5 million people are thought to be displaced inside the country in these weeks since the start of Russia's invasion. Europe hasn't seen an exodus of this scale and speed since World War II. Equally unprecedented back home here in Ireland, but very inspiring is the welcoming attitude that countries here and all over Europe, but particularly those who are on the borders of Ukraine have had towards the refugees. As of last week, Poland has taken the majority of refugees, close to 2 million refugees, and all 27 EU countries, as well as Norway and Turkey, have offered in-kind assistance. In Ireland, it's expected that we will receive up to 200,000 refugees in the coming months, 200,000 refugees. The Irish Red Cross is hosting a register of pledges to enable the public to give support to refugees and also offer accommodation and skills. All of this information will go into the chat for everybody. In Ireland, our HSC, our health service, is also responding. We just had an update from the HSC for this webinar from David Weekliam and his team. So far HSC donations to Ukraine are being provided via the EU Civil Protection Mechanism, and a donation of 2 40-foot containers of PPE left Ireland for Ukraine on the 11th of March. Also, HSC are working with doctors from Ukraine who have partnered with Lifeline Ambulance, and through this, deliveries of medical supplies have already been shipped out there, including 9 fully equipped ambulances. HSC ambulances will be arriving in Ukraine on Sunday. Here as well, HSC is coordinating health services for incoming refugees, including assessments and rapid access to care through a one-stop shop at Dublin Airport, which I'm sure many of us have heard about on the radio. We just want to say that we really welcome with open hearts and minds refugees to Ireland and to this community, and we will do whatever is possible to actively and support humanitarian diplomatic efforts. In terms of the in-country responses to the massive influx of refugees from Ukraine to the neighbouring countries of Poland, Slovakia, Hungary, Romania and Moldova, we're going to be hearing from our panelists about the humanitarian and health priorities right now in Ukraine. Not just the relief efforts for those still living in Ukraine, but how the international community is coordinating the response for those arriving into neighbouring countries. So just before I introduce our incredible speakers, just to remind everybody, as usual, we're recording this event. We make it available on the website straight after. We're live streaming right now on our YouTube channel. If you have any questions for speakers, please do use the question and answers. Our time is very short, so any questions you have, panelists might be able to answer by typing back, or we will certainly bring them to their attention. And please we encourage you to share messages using social media, and some of the hashtags are going to be there available in the chat. So introducing our panelists who have a lot of experience and are here to share what they know and their experience with us. Delighted to introduce 4 incredible speakers. Una Rose Hogan. Una Rose, you're so welcome. You've inspired us to do this webinar, in fact, from an exchange that we had, and we're grateful to you for that. Una Rose has spent 17 years working in global health security, in infection control, academia and clinical practice. Primarily, she's lived in sub-Saharan Africa, but also has worked in Central and Southeast Asia and Eastern Europe. She's currently working as a senior infectious disease advisor with Americares, a health-focused relief and development organization. And of course, she's also a current board member of the Irish Global Health Network. Una Rose, you're welcome. Also joining us, Joe Lowry is Senior Communications and Media Officer for the UN Migration Agency, IOM. Joe has had over 20 years experience, worked in journalism and as a communications specialist in quite some number of humanitarian emergency relief efforts. So he's a very wide and varied perspective on humanitarian emergencies, and we look forward to hearing from Joe. Thank you for joining us, Joe. Alongside Joe and Una Rose, we have Colm O'Gorman. He's the executive director of Amnesty International, and he has, before Amnesty, Colm was founder and director of One in Four, the national organization that supports women and men who have experienced sexual violence. He's also a former member of the Humanitarian, an author and regular media commentator and human rights on human rights and social justice issues. So really looking forward to hearing that perspective. Welcome, Colm. And then last but not least, we have Christian Gilardi. He's the Senior Humanitarian Advisor on GO's Emergency Response Unit, and he has significant overseas experience in many countries, including Kenya, Sudan, Zimbabwe, Zambia, and Yemen with MSF, and also with CARE International in Asia. He's also worked as a health integration commissioning manager for the NHS in England. So again, a wide perspective from the agencies that you're currently working with, but also the experience that you bring. So Una Rose, if I could maybe just coming to yourself, the humanitarian situation in Ukraine, it's significantly deteriorated. It's become a fully fledged humanitarian catastrophe. It's the worst situation is currently seen in the biggest cities under siege, especially Mariupol. Hundreds of thousands of people, we know that, do not have access to basic services, including water, electricity and heating. Food supplies are dangerously low. I know you're just back from the Polish border yourself. So, Una Rose, could you describe the situation there for just a little bit of the situation?
Sure, Nadine. I mean, I suppose, I'm always thinking in terms of like the specific health needs of the refugee population, and they're really vast and they're evolving as that conflict becomes more protracted. One of the things that, we think of many things, but one of the main things we think of straight away is non-communicable diseases and actual access to healthcare. So this is a population who's had their lives disrupted. So we have a situation where, routine non-communicable diseases and chronic diseases, things like hypertension, cancer, diabetes, suddenly pose an enormous challenge. People who are on long-term treatment can't access medical supplies, and this is exacerbating kind of those existing conditions. And we've all seen within Ukraine things like women who are delivering babies in really extreme conditions where there's no access to safe maternal or perinatal care. Obviously, given my background, I'm always concerned about epidemic-prone diseases and infectious diseases. And, prior to the Russian invasion, like everywhere, Ukraine had been battling COVID-19, but it also had a polio outbreak since October 2021. And, as you've alluded to there, during disaster, we often see increased transmission of infectious diseases, things like diarrheal diseases due to destruction of water and sanitation infrastructure, things like measles and polio outbreaks due to inadequate vaccination coverage, things like TB and HIV from lack of access to medicines, as well as, movement of populations and crowding. And I can say this from just having been along the Polish border, that there's an enormous volume of people just passing through, people in buses, in their personal vehicles, on trains. And the train station in Przemysl, Poland, where we have spent a lot of time, have really become humanitarian hubs with food, medical aid. So in saying all that, that's really thinking of the refugee population. We can't neglect the fact of the people who can't leave Ukraine and the risk of battlefield injuries there and the need for urgent acute medical care. It's enormous. I mean, the destruction of infrastructure that we're all seeing on the news, we can anticipate like supplies will dwindle. It severely compromises the health systems and their capacity to respond, from the direct and indirect consequences of fighting. I mean, mostly though, these conflict zones, they're inaccessible to most of us working in the humanitarian sector. So we can anticipate though, in the future, among the refugee group, we will see immense needs for trauma and injury support. Something else, Nadine, that comes to mind, and I hope maybe we'll have a chance to discuss this in more detail later, is the mental health needs of the refugee group. There's an overwhelming need for mental health and psychosocial support services. Exacerbation of chronic mental health, PTSD, depression, anxiety, all of these things we anticipate we're going to see in large volumes. This is also a priority area for Americares, so maybe we can touch on it in more detail later. So those are the kind of health needs that I initially think of, Nadine. They're enormous.
Yeah, well, you've painted a very real picture for all of us there. When you talk about, say, for instance, mental health needs, how do you start to respond to that? What kind of response? And I guess there's a short term and then there's a long term. And how do you balance that with the acute needs of people?
So I suppose, we know conditions like anxiety, depression, trauma, PTSD, they'll be prevalent among the refugee group. Americares actually has a long history of working with refugees on mental health. We work in Jordan with Syrian refugees, and we work in Colombia at the moment with Venezuelan migrants. And we know that early intervention can actually help prevent these conditions from becoming, enduring chronic conditions like complex, for example, PTSD. We have 2 members from our mental health and psychosocial team who are currently deployed and on the ground at the moment. And we use a technique called psychological first aid, and that's to give safety and comfort as well as stabilization, really, when survivors are emotionally overwhelmed. It's not a therapy, but in an immediate, urgent situation, it's designed to reduce the initial distress caused by traumatic events, really by listening to survivors, empathetically engaging in a compassionate manner, linking them with any services that are available. In addition to that, frontline type of work, we also work with established partners who are working in mental health in the sector in Ukraine through either provision of flash grants and through supporting their work.
Yeah, thanks, Una Rose. And I guess just a question for you. I mean, you've got quite a lot of experience in other humanitarian situations as well. I mean, when you look across the different situations, what have we learned? And those of us who've been involved for many years, we've seen many different crises. I remember myself working with WHO and being involved in Kosovo and being on the ground there. What have we learned? And are we responding quicker? What are you seeing that's different about this particular emergency?
Well, there's lots of things different about this emergency. I think generally in the aid sector, I think we would all agree that coordination has improved to some degree. That kind of disorder that was there, I think kind of the Rwandan genocide 1994 was really the precursor to the recognition of the need to organize. So, I mean, like the cluster system is obviously activated within Ukraine and just outside. And so probably our very first thing that we did was actually to plug into the health cluster headed up by WHO, and also to plug in within Lviv. There's an international Office for Coordination of International Affairs. So to register, say, with these, to plug into these, to attend the coordination meetings, to really assess what other partners are doing, because it's only through understanding what other partners are doing that we can ensure we don't duplicate and so on and so forth, and that we can carve out niche areas and work areas so that it's kind of appropriate. Like our emergency response team, of which I was part of, like we're assessing health needs so that we can coordinate shipments of medicines and supplies. But we also work with local organizations in Poland and Ukraine to give like emergency funding, and various other, supports in that way. We also at Americares, we have this, I suppose, roster basically for emergency medical teams who can provide primary healthcare services. So we've a roster of on-call physicians, nurses, other essential professionals who can give kind of surge staffing support to health system in neighbouring countries where hospitals and clinics are likely to see a sharp increase in patients. But probably one of the unique things, I suppose, that we can do is actually getting aid into the country. And this is probably, one of the incredible values I think that Americares can actually add. It's the supply chain support for medicines and medical supplies. Most distributors just aren't operational now. And, government and humanitarian stockpiles are mostly inaccessible due to ongoing military operations. We've all seen on the news, humanitarian corridors are not being respected. Right. And so getting aid in is actually particularly challenging.
Yeah.
So, we have a very clear idea of what's in short supply from our partners in Lviv and Kiev, things like oxygen, insulin, anesthetic, safe blood products. Yeah. So far, we've actually delivered about 4 tons of relief supplies into Ukraine on March 18th, and we have another 0.5 ton on the way. Yeah. So, and we anticipate that many additional shipments will follow in the weeks to come.
Great. Okay, great, Una Rose. Thank you so much. We'll leave it there and hopefully come back to you. And just kind of continuing the discussion, maybe coming over to you, Colm. A different perspective. We've all been reading reports about the indiscriminate attacks on civilians, and I know that Amnesty has been documenting those attacks, and that they really they're killing and injuring and causing a lot of the of suffering and health consequences as well. On Wednesday, I know just this week, Amnesty concluded a 10-day visit to the country, to Ukraine. So what was the outcome of that visit?
Well, we have since, thanks very much indeed, Nadine. We have since day one of the conflict been monitoring exactly what's happening in the conflict. So one of our roles in this context is to monitor and gather evidence of any possible breaches of international humanitarian law, of the rules of war, for example. So our crisis lab team that uses a combination of digital data sources as well as on-ground research has been very carefully monitoring what's been happening in Ukraine. And very early on in the conflict, some people on the conference may recall, we issued a report detailing a cluster munitions attack on a school in the east of the country in which 3 people were killed, including a child. Now, cluster munitions are a widely banned munition. Russia and Ukraine do both use them, and they've been used before in the east of the country. But that in and of itself constitutes very clearly a potential war crime. Since then, we've seen the use of indiscriminate weapons of dumb bombs and rockets and others against civilian targets, but also used in a reckless way that endangers civilians. Again, another breach of international humanitarian law. So we're documenting those. I mean, tragically, we're documenting these kind of violations now on a daily basis. Just last week, we investigated a case where 47 people were killed when a series of dumb bombs were dropped on people who it appears were simply queuing for food. So we know from what Russia did in Syria as part of its support of the regime there that this is a Russian tactic. It's not just to besiege a civilian population, but it's to bomb and batter them. Frankly, it seems almost intent on obliterating entire cities and bombing and battering civilian populations into surrender or submission in some form. So that's very, very worrying indeed. We've also seen attacks on protected targets, schools. People would be aware of the attack on the art school in Mariupol recently. But equally, I mean, the attack on the theatre, which was sheltering 1,300 people in Mariupol, despite the fact that care had been taken to evidence that children were hiding or seeking safety in the bunker there, in the cellars there. We saw that attacked. I know the World Health Organization has verified 64 attacks on healthcare facilities, so hospitals, clinics, and ambulances since the invasion began. And Ukraine's education ministry is saying that there's damage to more than 500 schools. So the attack on the deliberate, willful attacking of civilian infrastructure is clear, but also the indiscriminate use of weapons, which has resulted in widespread civilian casualties, is also very, very clear at that stage. And that's been a key focus for us. In addition to that, we've been monitoring what's happening on the borders as part of the flow, the very significant flow now, the largest refugee flow that we've seen in Europe in many, many decades indeed. So we've been on the border in Poland, in Moldova, in Hungary, and on the Czech Republic, monitoring what's happening there, gathering evidence and information from people who are arriving as well, obviously, but also monitoring what's happening there. Because sadly, there has been evidence emerging. In the early days, it was anecdotal evidence or social media reports of discrimination being experienced by people as they tried to cross over borders. Sadly, we've documented in the case of people crossing from Ukraine into Poland, very clear evidence of the Ukrainian authorities discriminating against non-Ukrainians who are seeking to exit, particularly, frankly, people of color, who very largely have on many occasions been prevented from leaving Ukraine by Ukrainian authorities. So that's obviously an enormous concern as well. The fallout, frankly, of this in terms of a refugee crisis then is very significant. I mean, if we take it back home for a moment, Ireland is a country that, generally speaking, in any given year doesn't bring in more than 800 people as part of this refugee resettlement program. And here we are now where, we're about to hit 10,000 people who've arrived in recent weeks. And, the view is that up to 200,000 people will arrive over the coming months. That's an enormous pressure. And as much as the response from civil society And in my experience, it's always magnificent, and it's been particularly magnificent in this context. It has been fantastic. We really need to start to think in the medium term about how do we support and sustain that level of community support. You know, we saw that in the Afghan crisis at a lower level, where we were directly involved, unusually, as Amnesty, in evacuating people and bringing them directly from Ukraine. About 100 people now that from Afghanistan, 100 people that we've brought from Afghanistan, and that then included finding accommodation solutions when people came here with community hosts. That was meant to be a short-term solution. It turned into a longer-term solution. Mm-hmm. You know, the same, frankly, is going to be true, probably more true in the context of Ukraine.
Right.
If 200,000 people come here, and if we see tens of thousands or more people being hosted by families in their homes, it's very difficult to see how there'll be a transition in the medium term into a new arrangement. So actually, it's critically important that we start to build in a wider support structure now around refugees and refugee families who are in hosted accommodation solutions. So supporting both that family, but also the family or people who are hosting them. Thankfully, Ireland has a phenomenal community sponsorship program that was ready to kick off in 2020 when the pandemic hit. And now we're very involved, engaged as a partner in that program. We're looking to reconfigure a lot of those resources and assets to begin to structure community support groups to support refugee families in a hosted situation when they arrive, to make sure that we have a better chance at looking at the sustainability of that kind of support, because it will be more than, you know, the 3 months that are
long term for sure. And Colm, I have to ask you a question. There's a question in the chat there from Massa, and it's about trafficking, and the potential for trafficking is very frightening at the moment. Any of you, have you heard of cases of trafficking? I see that Masha is asking, is there a hotline for people where they can report trafficking or abuse? Any thoughts on that?
We have documented, we had research that came out of our colleagues in Poland this week. We have documented evidence of and examples of both trafficking and attempts at trafficking. So in Poland, for instance, we've seen women being approached by groups of men when they've arrived in train stations in Poland, and there's clearly an effort to try to bring them out of there. We've seen other cases of actually women approaching unaccompanied children and looking to take their passports for them, etc. So there's significant evidence now of trafficking being a particular problem, especially when it comes to unaccompanied children. And we are seeing a significant number of unaccompanied children. More than half of Ukraine's children have now been displaced as a result of this conflict. More than half. And I think there's about 1.8 million refugees, child refugees now, who have left Poland. That's a massive concern. Trafficking and child welfare and welfare generally is a problem. And again, the challenge is going to be at the national level. Systems are not necessarily equipped to cope with that level of need or that level of, I heard, for instance, just in the last 24 hours that community hosts here will be Garda vetted. Whilst that sounds like a very good idea, I'm struggling to understand how our Garda vetting system is going to be able to vet 20,000 accommodation offers,
and how quickly, knowing how the process is quite
exactly. Yes. But equally, there's huge opportunity here. I'm talking to people who are already supporting people in hosted solutions. We have a significant number of teachers, for instance, from Ukraine who have arrived here. Ukrainian children are being very quickly given school places here, but actually there's a real challenge around language support, etc. So if we can begin to work with the refugee communities who've arrived in a much more dynamic, empowering way, they also can help to bring an awful lot of solutions to some of the challenges that we'll face in each country. But yes, absolutely, those issues around trafficking and exploitation are very, very significant issues. Yeah. But as all other colleagues from the various development and humanitarian organizations will know, sadly and tragically, that's a very real live issue in any situation such as this. And we have to be alive to it. We can't imagine that because this is Europe, and that's been one of the alarming narratives around all of this, that things will be different. It won't be.
It won't, and it isn't. Thank you for that, Colm. And I see Masha has said at the moment it's planning 7 days is the Garda vetting, the time that they're putting on Garda vetting. Colm, there's many more things I would love to ask you. So just hold there, and I want to come back. I want to move over to Joe Larry from IOM, and Joe's also just back from the Ukrainian border. Joe, like the IOM estimates more than half of the people who are internally displaced are women, and many are deemed particularly vulnerable because they're pregnant, they have a disability, they're victims of violence. Listening to Colm there, trafficking as well. Can you tell us a little bit about the situation on the border? What does it look like from your perspective, particularly?
I can. That's exactly where I was going to come in. I'll just talk until any questions occur to you. And let me a disclaimer at the beginning. I've got COVID brain going on at the moment, so sometimes I just forget common words. And so please.
That's okay. I'll come in if you forget something.
If you can guess what word I was trying to say, okay. Please do. And I did definitely want to start with setting the scene and talking about. Particularly about the ways this is affecting women. And I just want to also another disclaimer, my own personal interest here, because I spent a long time in Ukraine. Before I worked with IOM, I was head of delegation for the Red Cross in Ukraine twice. So I've lived there for about 4 years, all told. My second daughter was born there. I was married there. And I've got friends who are still living there. And a lot of it is quite personal to me. And when they talk about the neighborhoods in Kiev and other parts, because I've been all over Ukraine, that are being hit, it does become very personal. And in fact, I'm not humble bragging here at all, or even bragging, but it was my job is to speak to media, and I was being interviewed by CNN, and I almost lost it when I was talking, and my voice had a bit of a catch in it. And I was surprised, because I'm supposed to be a pro and do this all the time. So it definitely is something that, just seeing it is affecting me emotionally. Living it must be absolutely just trauma on top of trauma. And what we saw at the borders, and I was down in a place called Palanca, which is a real fly-blown border crossing, like something out of a Western almost. There's nothing there. It's flat land, sort of estuarine land, wind whipping in, terribly, terribly cold. And normally you'd imagine, it wasn't even an international border in Soviet times. It was just the border between Moldova and Ukraine. So it's only an international border for the last 30 years or so. You'd imagine about maybe a few dozen people crossing it any one day. And now you had up to 21,000 people, which is the population of a town like Portlaoise, crossing the border, emptying and crossing the border in one day. And it's only 40 kilometers from the outskirts of Odessa. So the thought is that if Odessa falls, or if the offensive really ramps up against Odessa like it has in poor Mariupol, then you'll see a big influx coming into Moldova there. It's quite easy to get into Moldova. The lines seem to be a bit smaller, but people don't really want to stay in Moldova because it's not the European Union, and that's what people are heading for. Although a lot of people, as in any refugee situation, people want to stay close to their home country, and what they want to get back home. That's what they want to do, much more than taking up the welcome that we're giving them. I'm digressing a little bit, thinking about women. What I saw there was really, truly heartbreaking, because, presumably, we know a lot of us have been in these situations before, but it affects you every time, and people perhaps watching haven't been. So to paint a picture, you've got, because that's what I am supposed to do. I'm not a health expert, I'm a journalist, which means I'm an expert in absolutely nothing, but I can tell a story. And you're seeing families coming across the Ukrainian border in view of the Moldovan border, and there's sort of no man's or no person's land there, where people are queuing up. And you can imagine the families have all been together on a horrific journey from Mariupol, from Kiev, from wherever they've come from. And these are people, you see in their eyes, their clothes, their faces, that these are people who are out having a coffee a few days ago, or watching football with their mates, or playing football with their mates, or going shopping, or doing what people do in a European country. And then you see them, queuing up in their thousands. And obviously, every single question is going through their mind about what happens next, what do we do next, where are we going to go, where are we going to end up, where are the kids going to go to school. But I don't think those things really hit until you've got the family to safety. But in a normal situation, a normal refugee situation, the whole family would be going across together. But what's happening here is you see the mums and the kids and the dads and the in-laws together, and then you'll see a policeman, Ukrainian policeman, with the father or with the men in the family, anyone between 18 and 60, with a hand on their shoulder, basically saying, don't take too long over this. You've got to go back into Ukraine to fight, to die, who knows. And the families are together all this time on this awful journey, leaving their home country behind. And then suddenly they're not. And the women become, within 3 steps from when they turn around and say goodbye. And when they cross that border, they become not just refugees, which they never thought they were going to be. They become single mothers. They become heads of family, the sole heads of the family. They become carers, perhaps for their in-laws who may have long-term diseases that Una Rose mentioned earlier on. And then it must become really seriously real to them there when suddenly their family structure is broken up. The person they've lived with and shared a bed with for 15, 20 years has just gone that way, and you're going this way. And you don't know when you're going to see him again, when you're going to talk to him again. And so the burden on women must be absolutely just phenomenally frightening. And you see, the mothers generally keeping it together until you interview them. You start talking to them about what's the plan next. That's when the tears start on both sides sometimes. But that's when also you can see that they're really holding everything in. For the kids, I mean, it must be equally disturbing and just totally confusing because they don't understand what all the ramifications are with daddy going back that way and then us going on this way. And so what I've been the three things that I've been talking about, if I've had a platform, have been humanitarian border management, which is important because you have to decongest borders. Borders aren't generally particularly nice or hospitable places. As a sidebar, someone said to me recently that the borders are designed by men, and yet you've got thousands and thousands of women going through, and generally women's needs going through borders aren't thought about when you're planning a border. A man thinks about how to get people across a border, doesn't think about the specific needs of women or children. And it's also important in terms of getting safe transport from A to B, which is what we've been doing, IOM and UNHCR, laying on buses to get from Romania down to the Moldovan border to get people back to Romania again, so that they can then continue their journeys from there or seek asylum in Romania, whatever their plans may be. And that can help to stop the threat of trafficking, which Colin there alluded to there. And that is really significant. And I noticed on the RTE news last night, someone saying that they were in, I can't remember, Poland, I think, trying to bring people back, but people weren't believing them, that there could be these offers of accommodation and schooling and so on. So the anti-trafficking education has worked, but it's still, I mean, there are going to be horrific cases. And when we talk about protection, we do talk about, of course, the protection of the Refugee Convention, the protection of the international community for people, who have crossed borders, fleeing violence. But it's really just protection from harm as well, protecting people, because this is a predominantly female refugee flow, and everyone knows that one of the ways to get money in the situation is survival sex, and there certainly will be people preying on these young women, sometimes very young women coming back.
Yeah.
Do I have a little more time?
Thank you, Joe. Just if you one more point, and then I'm going to move on, and I'll come back to you. I really want to come back to you as well.
The point was sort of what can we do? What can we do? We as the international community, and we as citizens, what can we do? And also to pose the question about the need for cash versus stuff. People will, with the best will in the world, load up buses and trucks and so on, and get them to full of nappies and blankets and whatever else. If you're going to do that, I mean, the preference is give cash to large organizations that do this 24/7, because they know and they can get humanitarian aid into Ukraine, whereas if you're driving a truck and you're on the border, you're not really going to get in or know where you're going or speak the language and so on. But if you are going to send stuff, make sure it's actually needed. Check first, call up where you're sending the stuff to and say, do you need this? For example, where I live in Vienna, one of the shelters, they had lots of conditioner but no shampoo. They had tampons, but no nappies. So call and find out what's needed.
Yeah,
thank you.
Thank you, Joe. And I think the Red Cross here in Ireland, and also we've put on our own website a list of places that people can donate to organisations who are on the ground or have branches on the ground. So we'll definitely do that. Thank you for that, Joe. Really important perspective. It's just you really painted the picture for me, and I'm sure everybody listening, of that journey across the border onto a bus, and then, for instance, landing in Ireland, and those same children, maybe arriving on a Friday, and then Monday they've been placed in a school in a small village in Ireland. So it just just put places of context for everybody who's able to support. Christian, can I move over to you? We would love to hear a little bit about Goals Response, an agency that's been on the ground in humanitarian situations, flying the Irish flag for many years. Just tell us a little bit about the situation. What is Goal doing, particularly in terms of health responses? How is Goal thinking about the health response, and what programs are you currently working on?
Thank you, Nadine, and thank you so much for the invitation to this panel. I'm going to start. We came 3 days after the invasion into Ukraine. So on the 27th of February, we were already in Poland. And we have partners that we used to work in the past within Ukraine. From 2014 to 2017 or so. So the first things we did is just to visit the border and crossing points, several crossing points here in Poland and Ukraine, just to see how the situation was. And of course, perhaps the first influx of people was different to what I've seen in the past in other refugee situations, where perhaps the first people that they were crossing had the means to actually get to the border and cross, or have contacts either in Poland or other part of Europe, so they have someone to actually host them at the beginning. But nonetheless, there were a bit of concerns in terms of protection issues that they might be raising, and that was something that we observed, not just only when they were crossing, but then also perhaps on those temporary shelters or distribution centers where people are resting for a night or two, and then being picked up by buses and being taken to the places where they wish to go. However, not all of them were going to those shelters where people were crossing, and some people were waiting for them in the other side of the border. So most of them, they knew where to go, or they have someone to meet, but there were others that they didn't. So there was a bit of a lack of perhaps of information available to them back then. Things have started getting more organized since then. We also visited Lviv, so we were visiting some shelters in Lviv, and those are shelters that they've been kind of organized by the whole community. The communities are the ones actually trying to host. In the first week or so, there were already 200,000 people being hosted in Lviv. So that's just an additional 200 people in a city, and they were being hosted in theaters, schools, cinemas. And the conditions, perhaps, they were not optimal. They might be good for 1-2 nights, but then later on, there are some challenges. Maybe they have mattresses, but they didn't have beds. And yet, although they were mostly women and children, also there were some issues in terms of protections, and also the uncertainty for them what to do next. So they wouldn't know whether to continue the journey, or just waiting for a while to see what things happen. So we've been coordinating with the city council in Lviv and see how we can actually support those shelters, and also making sure that they can actually have access to the basic needs. They are covered, but then also medical access, or attention, Of course, the system in the Western Ukraine is fully operational. Let's say you will have access to food. You know, you will have access to hospitals and medical care. But you don't know when, because the numbers are increasing so exponentially. You know, you don't know for how long the system will be able to absorb so many people displaced. So, yeah, as my colleagues were saying, there were a lot of needs in terms of psychological support within Ukraine, but then also people crossing into Poland. We were talking to a lot of women and teenagers in the border, and you know, the uncertainty of what next for them. You know, suddenly they have a normal life, and then the next day, just everything was left behind. Just only one bag they're carrying with them, and that's it. And then leaving the parents or the father and the brothers back then, and Ukraine it creates a lot of anxiety and stress and so on. So psychological support is something that is critical, I think, as Una was saying at the beginning of any intervention.
Yeah.
Medicals and supplies and the ease. With our partner, we are supporting, trying to get not just only preposition, also stocks for the next couple of months or so in terms of food and non-food items in the east of Ukraine, where there is more needed. But then at the same time, exploring how we can support in the west of Ukraine with different, especially cash programs, you know, multi-purpose cash. I think is critical for people to choose what to get, you know, how to use that money for medicines, for shelter, or whatever they need. I think it's more dignified in the sense to use cash. And then yes, we were also supporting. We are working with other NGOs, local NGOs. We're trying to support local structures and civil society to respond. So not coming just only to implement, but also to actually mainly do our interventions through our partners or with our partners. I think that is critical for us. In terms of things that we've seen in some of the shelters, poor ventilation and overcrowding, that creates a bit of a risk or in terms of health, and then we know about the also optimal vaccination in children. So there is no vaccination coverage fully. So there's something that we need to look into quite close. Medicine supply for chronic disease, I think it was mentioned before by our panelists. That's something that we are also looking and supporting. Basically, we support some hospital directly and providing some medicines and medical equipment. Yes. And then something that we are actually quite much involved into the health cluster and trying to coordinate with other NGOs and UN agencies and also the government to make sure that we do a meaningful intervention.
Yeah, and thank you, Christian. You've also painted a picture. Una Rose mentioned the health cluster, and you kind of start to get a picture just from listening to the to your various contributions today. You start to get a picture of what that's like. Thank you so much, Christian. I think we haven't even. You talked about vaccinations. We're still in the middle of COVID and a COVID pandemic, and what happens to the priorities in terms of COVID and infection rates and vaccinations and all of that. So that's one one question, maybe just for somebody in the panel, if you'd like to pick that up. And the other is, I see there's a question in from Rory there. You know, could the panel comment, you know, what sort of digital health tools the frontline healthcare workers are using? If mobile clinics are being set up at checkpoints, how are you actually finding individuals that need care? So just a couple of different questions. And thank you, Genevieve, for your comments. We really hear them. So over to you, whoever would feel like, Una Rose, I see you there. Look like you've got a response there. If you want to come in on something there, oh, welcome.
Sure. Well, look, when it comes to COVID-19, I'll always have a response, or anything infectious disease related, really. So I'll answer the COVID-19 one first, and then I can mention about the mobile health clinics. But maybe I've returned over a week ago, so maybe somebody who was there more recently might have more updated information on that. So in terms of COVID-19, it's always a concern. Something very remarkable about Ukraine that I'd really like to mention is that they have actually maintained their COVID-19 data reporting even during these initial weeks of conflict. I think that's really remarkable. Just before this meeting, I was reviewing OCHA's situational report, and last week, say up until the 16th of March, it was somewhere around 560 deaths from COVID reported in Ukraine, right? So, but we know that these have, you know, testing has plummeted, so the case numbers are grossly underreported. But the conditions on the ground are an ideal environment for, you know, a COVID-19 resurgence. Ukraine has an adult population, about 34% were vaccinated, about 10% were boosted, and a pediatric vaccination campaign had only started in the weeks prior to the invasion. So the pediatric population, well, in fact, the entire population, it's largely unprotected from COVID-19. So, you know, I mean, we've all spoken about these, you know, the enormous volume of people coming over the borders, you know, they're bottleneck locations, people have to congregate, and essentially, so it's a life-saving measure. It has to happen. But we do need to think about this in terms of, you know, emergence of new variants of COVID-19 when it's circulating at such high prevalence. And indeed, you know, the humanitarian aid workers who are there on the ground as well, just the whole congregation of people and, you know, the mobility of people, which we know COVID-19 is associated with. We probably want to look at doing things like strengthening, you know, national responses to COVID-19 in the neighbouring countries, you know, to kind of mitigate that community transmission. We should also, well, I mean, you know, need to think about maybe vaccination of the refugee population, particularly as they resettle, say, in other countries, and making sure that that's offered. I could say a lot more about COVID-19, but we'd be here till tomorrow. Who was it? Was it somebody asked that other comment then about the mobile health clinics? Rory, just to let you know, I mean, the mobile health clinics, I'm going to speak from what I saw on the ground. Somebody else can maybe update you because I've been home for about a week now. But say, I didn't see any mobile health clinics at border posts, right? Because you see, this isn't a typical refugee response. They're going from a middle-income country to middle-income countries. So most of the health needs are being absorbed in the country to which they're going. So if we take Poland, for example, like it's being absorbed by the national, you know, hospital systems, and the Ministry of Health in Poland even has issued, like, you know, there's 120 hospitals across Poland, which, you know, to which Ukrainian citizens can go. In fact, they can probably go to all of them, but they're accessing healthcare as per normal, as you would in the receiving country. So it's a little bit different. Now, I don't know if anything like that has changed in terms of mobile health clinics, but I don't believe so, because you know, at Americares, that's actually what we do in terms of mobile EMT clinics. And we haven't had a request for that yet at the moment. Yeah. So I'll hand it over to somebody in case they're...
Thank you, Una Rose.
Thank you.
Thank you very much for those points. Colm, I see your hand up, and I don't know which you're going to come into, but I'd also love, I know briefly we touched on just before we went live here on the situation inside of Russia with civil society organizations there. And I wonder, in addition to whatever it is you'd like to comment on, if you could maybe say something on that.
Yeah, just very quickly on COVID-19 and vaccination. I mean, again, we need not to take our eye off the global picture here. I mean, as of the 23rd of March, the World Health Organization is reporting 6,100,000 nearly deaths now at this stage. And yet we're still at a point where there are more booster shots being administered in high-income countries than first shots being administered in low and middle-income countries, where 2.8 billion people globally are still unvaccinated. So the scandal of vaccine inequity is just, I mean, it continues to be just quite extraordinary. And I mean, again, we saw some compromise solutions coming out in relation, supposed compromise solutions coming out in relation to the TRIP proposals from the European Union this week, which, is somewhat encouraging, but actually there are real concerns about some of those compromises. So, you know, in the midst of this crisis, we can't forget that there's another massive global crisis happening, and that level of inequality and inequity in access to vaccines and therapeutics is killing hundreds of thousands of people in the global south, and that continues. The situation in Russia, and actually both in Russia and Belarus, I mean, we're directly involved in supporting human rights defenders and other organizations, yes, in Ukraine, evacuation from Ukraine, supporting Ukraine. There are many people in Ukraine, for instance, who are under particular risk from the Russian invasion because of work that they did on the invasion and the conflict that was already happening in the east of the country. And that actually includes some of my own colleagues and my own counterparts in Amnesty Ukraine, who were documenting and had been for many years documenting violations as part of that ongoing conflict, which, as many people know, was happening for about 7 or 8 years. But yes, I mean, in Russia, I mean, the situation in Russia has gone from appalling to absolutely horrendous. I mean, it's now a criminal offense to use the word war in the context of what's happening in Ukraine. To call for peace, this can lead to a 15-year prison sentence. So the suppression of civil society and of media in Russia is enormous. And we are seeing, yes, indeed, very significant now threats and crackdowns, both in Russia and Belarus, on civil society there. And we're seeing more and more people having to evacuate from those countries. And of course, then there's a concern that because there are limitations being introduced on visas and on Russians and Belarusians who might travel, that actually people who are at risk in those countries at the hands of those autocratic regimes now are at greater risk because other countries are not providing them with safe routes for evacuation. I must say there are solutions being found to that, but it's a very, very significant issue.
Well, thank you for that, Colm. And it just kind of resonates. I heard Mike Ryan speaking on the radio this morning, just saying that he's never seen such a complex crisis develop over such a short period of time. And just adding those dimensions, you know, just start to see the layers and layers of complexity. Thank you also for bringing the attention to vaccine inequity. We've put a link in the chat there to the People's Vaccine Alliance, something that we're very, very passionate about as well. Niall, I see, has asked a question. Maybe Joe or Christian, you'd like to come in on that. Is there a risk that aid agencies are too focused on appealing for Ukraine-specific funding? You know, is it possible that we'll have a repeat of Kosovo in 1999, too much earmarked funding that inhibits flexibility to respond to other existing crises, for instance, Yemen, Ethiopia, and then the new crisis that will emerge in the coming months, not to mention what might happen with COVID. So any thoughts on that, Joe or Christian?
I can say that we continue our operations in many of the countries that they are at the moment in conflict, like Ethiopia, Syria, and Colombia. So we South Sudan. So we are still continue our interventions in those countries, and you know, working as hard as always, trying to support those communities. So no, it wouldn't make any change for us.
Thank you, Christian. And Joe, any thoughts on that yourself, and anything else you want to add to what you've heard?
Yeah, I think that, you know, what the UN consolidated appeal for Ukraine was one of the fastest to meet its targets. The generally UN appeals don't reach their targets. This one was appealing for 1.5 billion, and I think it's nearly fully funded already. ILM appealed for 350 million, and again, money is coming in faster than that. But I don't think it's just about the money. What's the most important thing is the solidarity, the compassion, and the simple kindness that's going to have to be shown by people in the now and in the weeks and the months and years ahead, because they're going to be, you know, societies and there's going to be like villages in Ireland probably which may even have almost majority Ukrainian populations. I'm exaggerating a bit for effect, but it's going to be a lot of new people coming into our communities, and they'll need the same things that we need to survive. They'll need jobs, they'll need places long term for their kids in school, they'll need healthcare, they'll need all the things that we rely on and that we expect for our everyday lives. And so we have to be prepared to share this and to keep on sharing this until such time as Ukraine is at peace, which we hope will be soon, and people can go back to rebuild their lives there.
Yeah, thank you, Joe. Joe, I just wonder, I'd love to hear from all the panelists, just a message, if you'd like to leave, people watching this and will be watching this, from your experience, you've just recently come back from the border. What do you want to say to the people living in Ireland who are working on these responses, interested in global health, and all of those listening, just listening, living in communities around the country? What would your messages be to us?
Well, I think I just said it really. Be kind.
Okay. Okay. Good. Well, what I can see already is we have flags that, this flag that we have here in our background today. I see all, communities, schools in the place where I live have all got flags outside, and huge supports and displays of solidarity already coming. And then, as Colm said, it's just a question of making sure that those things are systematic and over time thought through in the long term. Joe, thank you so much for that. Maybe Colm, I might come back to you, just your perspective. Also, I know activists are now joining Amnesty's global action, calling on Russian authorities to stop the acts of aggression and protect civilians. It's been signed by already 340,000 people. Can you tell us a little bit about that campaign? Can that influence Russia's actions? What have you to say about that?
Well, we have to continue to make it clear to Russia that its actions are unacceptable to the international community, and that's not just at the political level, but that's at the civil society level. That's unacceptable to people. I'm thinking in particular of President Zelensky of Ukraine calling on people to come out to their squares and to their streets today to stand in solidarity with Ukraine. We can be dismissive about the significance and the importance of solidarity, and as I'm sure all of my fellow panelists will speak, very often those acts of solidarity mean an awful lot to people who are experiencing crisis. Now, they're not enough alone. So, I completely agree, be kind, but then we also have to make sure that we can sustain kindness. Mm-hmm. And that means not just sustaining the people to whom we're showing kindness at the moment, but sustaining each other as we look to live from that place of kindness, because it is going to be challenging. So I'd like to say something that just sets up some hope in all of that, right? When we think about the number of people who are going to arrive here, the average refugee is a net contributor to their society and their economy within 2 years of their arrival, right? So yes, there will be big challenges when we're bringing lots and lots of people in here to Ireland from a logistical and a community perspective. And again, let's sustain each other with kindness and with love and compassion so that we can sustain the people who need our support really, really effectively. I'd ask people to pop along to the opencommunity.ie, which is the community sponsorship lead organisation here in Ireland. And we're going to be rolling out from there tools and resources to help communities support communities to support refugees when they arrive over the next number of weeks. And we're working with lots of partners on that as well. So that's incredibly important. On the accountability piece, accountability has to start to happen on foot of war crimes. The reason why we see regimes like Russia and others carry out these kind of attacks is because impunity is tolerated at the international level. We have to start to insist that our governments, and that includes the government here in Ireland, demand accountability for these kinds of breaches of international law. Russia must be held accountable for its violations. And that's why our work as part of that crisis lab piece is so important. It's not just about showing people in real time what's happening. It's also about gathering and documenting the evidence that can be used to ensure that we hold people accountable for their crimes that they're perpetrating as part of this conflict. Accountability must happen and impunity must end if we're ever to secure meaningful peace and security at the global level. And, frankly, it's good to hear that there's at last conversations happening about the need to significantly reform the Security Council, for instance, who's completely ineffective in its current role because its mandate is to guarantee peace and security, and yet its 5 permanent members can simply veto any action to happen. And we've seen the nonsense of that with Russia. So there's grounds for hope arising out of what seems like a fairly awful situation, but only if we're really focused and supportive of the efforts that we need to make sure this is sustainable and a change moment.
Brilliant, very powerful words, very eloquently put, and really hear that. And Colm, thank you. In the chat, we've put a link to the open community that you mentioned, and it's also on our website along with those other organizations that people can go and contribute to. Christian, any last words from you? And then Una Rose, just very briefly.
No, just only to thank, and I think as I will echo what my colleagues were saying, the kindness has to continue. It's not just only now because it's in the media. It's that will last for a while. and we need to make sure that we support the Ukrainian people there, but then also when it comes to Ireland, to be kind and to help them to integrate, because they might be there for a while. They are generations, mostly kids, and we need to make sure that they are welcomed and supported.
Thank you, Christiane. And it just really stuck in my mind, half of the children of Ukraine are already displaced and moved from the country. I mean, that's just an incredible thing to even contemplate. Thank you, Christiane. Una Rose, any last words from yourself?
Yeah, Nadine, I would say, just extending on from that, this Ukraine crisis, it seems to have inspired something in people. I don't know if it's the proximity or what. I hope it sustains beyond this crisis. And let's not forget Yemen, Central African Republic, Syria. I mean, this has been going on in Syria for the last 11 years. Right. Where's the open door policy for all of these people? We need to just not forget everybody else. And I hope that the way this has inspired people to open up for Ukraine, it might actually make them realize that, we are the same no matter where we are. And we have a lot to offer and basically support as a coming from a wealthy country like Ireland. But just that I hope it inspires future compassion and humanitarianism.
Thank you, Una Rose. Extremely well said. And I think, the world, the universe just keeps giving us these things keep happening. The world, it keeps giving us the COVID pandemic, these different wars and situations. And it's our opportunity to respond to that. How do you respond to these things? And, what I'm taking away from today, even more so, is just there is something that everybody here can do. Everybody can do something. I see the different perspectives coming in from the speakers. Everybody has different passions, different expertise, different ways of contributing, and do something. If you do nothing, leave this webinar and do something on our webpage. It'll be in the chat. Again, we're directing you to those organizations who are on the ground, who are making a significant contribution. And if there's nothing else that you can do, you can always be kind to those people who are, people who are going to be coming into our communities, and not just in the short term, but I loved what Colm said. How do we support each other to sustain that kindness? And we can do that in Ireland. We are very good at that. So let's do the best we can. Very grateful to each and every one of you for really sharing, helping us all understand and be with you. Those of you who are really on the front lines there. And thank you so much for your work. The recording will be made available. And for any Ukrainians who might be watching this, our hearts are with you. And just let us know what we can do. So thank you, everybody, and we'll be in touch soon.